If you've ever taken Viagra, you probably know that you might get headachy, like flushed face, maybe some reflux or muscle aching, or just generally feeling a little bit off. And there is a reason for that, and everyone gets told that there's side effects, but not many people really understand why these side effects are happening. So let me explain. My name's Luke. I treat mental health problems like erectile dysfunction with shockwave therapy and nerve stimulation. And basically everyone I've ever treated has tried out these medications, used them for a time until they eventually get sick of the side effects or they stop working, and that's when they come and see me. You might be someone who's still taking these meds and starting to notice that the side effects are bad, so here's why you get them. A lot of guys kind of just think like, oh, maybe they don't agree with me, and that's quite reasonable, but actually a really high percentage of people do get side effects, and as your condition progresses, the requirement for these medications goes up. You're going to need to take a higher dose of these meds as your condition gets worse, and higher dose equals worse side effects. Now, to understand the side effects, you really need to understand what the medication is actually doing. So if you think about what an erection is, it is a blood flow experience, okay? It's like there could be anything which stimulates the erection, whether it's arousal or tactile or hormones or whatever it is, but at the end of the day, the blood vessels need to open. And what some clever guy realized was that if you get medication which forces the blood vessels to open, then we then have a short-term resolution for erectile dysfunction. But the thing is, these medications, they can't target just one area of the body to create what we call vasodilation, blood vessels to open. That would be a pretty miraculous pill if we could do that. The more likely thing is that in other areas of the body too, there's going to be a similar response. What we call smooth muscle is actually going to relax, which is going to allow the blood vessel to open, but then that's going to be a situation which happens elsewhere in the body. So if you think about what the headache is, it's like, yeah, you've got blood vessels in your head and then they open, and then that creates pressure changes near the brain, and the body says, holy shit, what's that? And it sends you a pain signal. It doesn't like that pressure change. If you think about the flushed face, like, why would you get a red face? Blood vessels in the face opening up, and that's why you get all that redness. It's literally blood coming to the surface of the skin. Reflux is a tiny little bit of a different one, because actually there's smooth muscle not necessarily related to blood vessels, but smooth muscle around that area near the esophagus, and as it relaxes, again, it causes a functional change in that area. People start to feel reflux symptoms. And again, with muscle pain, you make muscles relax in some ways, it makes other ones kind of react and switch on, and that's why we possibly get some muscle aching, especially with Cialis. Once you understand kind of what these pills are doing, and you realize they are just a short-term fix. Now, people often will think and feel like they have a management strategy with a PDE5 inhibitor like Viagra or Cialis, which is sildenafil and tadalafil. But the reality is that this isn't a long-term management strategy. This is a very, very, very short-term, as most people will know. With Cialis, you might have a few days of feeling like things have improved, but with Viagra, you've basically just got that night. So if you want to actually look at proper management strategies, you need to look further than just pills. You need to look at something which is going to give you a long-term vascular blood vessel change, not a short-term one. And the thing that we do here at Men's Room is shockwave therapy. So you're not going to get a quick fix. Nothing's going to change on the day. It's not going to change the day after. But a course of treatment is going to create vascular changes which actually last a long time to get you off the tablets, to stop you having to have all the horrible side effects, and actually reverse the condition and resolve the problem for the men that it works for. So if that's something that you're interested in and you want to have a discussion with us, all our information is going to be below. We're in the Surrey, South London area. We do a lot of this work. It's safe, it's effective, and yeah, it's very much appreciated from a lot of the guys that get it. So if you're interested, give us a shout down below.